9. Hospitals. Chapter 9. Introduction to a Hospital. Jordi Pon is a fourth-year medical student from Barcelona. He has come to Britain on an elective attachment to the Royal Infirmary, Edinburgh. Dr. Barron is introducing him to the hospital. Dr. Barron. The Royal Infirmary is the name of the University Hospital from Edinburgh University. It is a general hospital dealing with all types of patients and illnesses, except pediatrics. We have a specialist hospital for that in another part of Edinburgh, the Hospital for Sick Children. You can see some of the departments in our hospital on the side. Of course, there are many others. For example, the Intensive Care Unit, ACU, and the Surgical High Dependency Unit, HDU. Jordi, what does outpatient mean? Dr. Barron, outpatients are the people who come to the hospital to attend a clinic or to have tests or treatment and then return home on the same day. Inpatients stay in the hospital for one or more days. The rooms where they stay are called wards. If a patient's treatment requires only one day, such as a simple operation, they can be admitted to the day surgery unit. So, welcome to the Royal Infirmary. South entrance. Car park C and D, visitors and staff. The Symptoms Center. For reproductive health. Gynecology emergency. Maternity emergency. Neonatology emergency. Outpatient department, a ward, day surgery unit and endoscopy. Day surgery X-ray department, combined assessment. Outpatient. Dr. Barron. The accident and emergency department, also called casualty, is where patients who are actually ill with a sudden serious condition come for assessment and treatment. Outpatients who have an appointment to see a specialist go to a clinic in one of the outpatient departments. They have usually been referred to the hospital by their GP, who writes a referral letter to the consultant explaining the patient's problem. Inpatient. Dr. Barron. The inpatient in a hospital are admitted in one of three main ways. They may be seen in one of the outpatient clinics and admitted from there, or if there is a lot of demand for the treatment they need. As in the case of a hip replacement, they are put on a waiting list for admission. Alternatively, their GP may arrange the admission by telephone because they are actually ill. For example, with suspected myocardial infarction, or they are seen in the A&E department where the doctor on duty, working at that time, arranged the admission. This will happen in the case of a patient with fractured neck and of femur. For example, larger hospital may have an assessment unit where patients can be admitted temporarily while their condition is assessed. Jordi, assessed? Dr. Barron, yes. Decisions are made about their condition and what they need to be done to help them. After treatment is completed, the patient is discharged back to the GP care. Exercise. Complete the table with words from A, B, and C opposite. Put a stress mark in the front of the stressed syllable in each word. The first one has been done for you. Verb. Admit, assess, discharge, operate, refer, treat. Noun. Make word combination using a word from each box. Look at C opposite to help you. Acutely, assessment, on, referral, waiting, unit, letter, list, duty, ill. Which hospital department will be most appropriate for the following patients? Look at A, B, and C opposite to help you. A woman in diabetic coma, a patient who has just had a radical prostatectomy, a patient who is to have a skin lesion removed, a man with a foreign body inside, a woman with a threatened abortion. Complete the Stratford and information leaflet for patients. Look at A, B, and C opposite to help you. Information for outpatients. When you arrive at the, please tell the receptionist who will welcome you. Check your details and direct you to the waiting area. The length of your visit will depend on the you're going to have. You may need to have some, such as an X-ray, which could mean going to another, or you may be to other professionals, such as physiotherapists or dietitian. You may need to revisit the clinic. If staff at the clinic want to see you again, another appointment will be arranged for you. If you need to be to hospital for more treatment, either as an inpatient or for surgery, you will be told when this is likely to happen. If you do not need further treatment, you will be to your GP's care.